So, Namaskar everyone. My name is Dr. Manish Yadav, and today I welcome you all for this new talk on diseases of spleen. As we are in continuation of understanding James Compton Burnett from his different sources, we have talked about many of his cases, many of his approaches. Now, slowly and steadily, we will go ahead, and this playlist, this special talk is especially on the book called Diseases of Spleen by James Compton Burnett. So let me start with that. Before, as we talk about organopathy, we're going to talk a lot about organopathy. And if there's a disease of spleen, what has to be done? As we know more about these remedies, the idea behind knowing these remedies and the better use of these remedies can only happen only if we are pathologically, means physiopathologically, we are sound enough to understand the basic parameters, the basic clinical diagnosis, and the pathology and physiology of how these organs work. Because the patients who is going to come to us, once we are not aware of the pathophysiology of the disease organs or the healthier organs, in fact, it can be a difficult story to get into the organopathic drugs application. So here we first start with spleen. So today we're going to talk about spleen. Already we have spoken about liver and have discussed about chelidonium as a remedy. Now in this section, I'm going to talk about various spleen remedies that Burnett used to use. But as I was studying them, I realized that it is very crucial to go back in our college time and in the past and open our anatomy and physiology and get brush up with this organ understanding. So in this short talk, I'm going to specifically talk about the spleen as an organ, and it's going to be a very short talk just to brush up so that we are again equipped with the understanding of the organ, and then we will embark on the journey of understanding the spleen remedies, the organopathic remedies that can be used in our homeopathic practice. So let's come back to the short understanding of spleen. This is the anatomical positioning and its location in the body organ. This is how spleen looks like. How it is defined. What is spleen exactly? Spleen is a part of your lymphatic system. What does that mean? It means that it's a part of our immune system. And its main role, the main role of spleen is actually to keep a body healthy. How that can be done, we will understand slowly and steadily. So if you can see the size of spleen, the shape of spleen, there are splenic veins and arteries which carry blood in and then out. These are two parts. There are two parts of spleen and each have different jobs to do. Now we have to understand these two important parts and watch out for exactly what they do so that we can use it clinically in our practice. White pulp and red pulp. What does white pulp do? This part as a part of the immune system. So white pulp is a part of immune system. White pulp produces white blood cells. These blood cells makes antibodies, and antibodies definitely fight against the infection. So all the WBC formations, antibodies that have been formed towards an infection when a bacteria or viruses attack, the antibodies that are formed, a lot of things has to do with this white pulp. It helps in producing these antibodies so that we can fight the infection. What does red pulp do? The red pulp, this area of the spleen does is it's act like a filter. So red pulp acts like a filter. It removes the waste from the blood and gets rid of old and damaged blood cells. Red pulp also destroys bacteria and viruses also. So the filtration part. So red pulp is a filter where all the waste products of the blood, they come and it collects the old and the damaged blood cells. I hope you understand. Of course, you know that every cells have a life cycle, have a lifespan basically. So in a day, then they become older, weaker. So it is not of much use. So spleen filters them and gets it out of our body. So two important parts. One is to form antibodies. Second is to get rid of the waste products from the blood. Spleen is a significant organ of hematological and reticuloendothelial system. It is an interperitoneal organ located in the left upper quadrant of abdomen, posterior lateral to the stomach. Spleen is situated anatomically behind the ninth and the left rib on the left side of the body. Okay, that was the location. But what is the function? What does it do basically in depth if you try to understand? Number one, it stores blood. It stores a lot of blood. Filters by removing cellular waste and get rid of old and damaged blood cells that we just did in the last slide. So number one, it stores blood. Second, it get rid of the waste and the old, basically damaged blood cells. Makes WBC, white blood cells, and antibodies that fight your infection. Maintains the level of fluid in your body. Produces antibodies that protect you against infection. What are the conditions and effects of the system? But before that, let us just brush up this point. So if you look at it, the major part, if you can understand spleen as an organ, it has to do with lymph, that is as an immune system, means fighting against the infection, producing antibodies, WBC count, more WBCs, and getting out the waste of the blood cells, especially the old and the mature cells or damaged blood cells. Which are the conditions? Now we'll study which are the conditions basically and disorders that affect spleen. There are many disorders and conditions, injuries and diseases can cause problem in the spleen. So what these problems can include, what can happen to the spleen? Number one, the most common thing is splenomegaly, that is enlarged spleen. Functional asplenia, damaged or ruptured spleen. These are the three things that can happen. Means it can enlarge, or functional asplenia means it completely, its functions are stopped, it cannot function. And second, and the last one is damaged or ruptured spleen. We'll understand each one slowly and steadily. Enlarged spleen, that is called splenomegaly. Clinically, this is what we encounter a lot in our practice. Now, which are the conditions, which are the diseases, and which are the conditions that we get splenomegaly? Blood cancers, especially leukemia and Hodgkin's diseases, and cancer in other parts of the body that metastasize or spread to the spleen. So, as you know, it has to do a lot of work with the blood. So generally, anything to do with blood or lymph, both the things, the blood and the lymph, any disease of that will definitely affect the spleen. So leukemia, cancers like leukemia, Hodgkin's disease or Hodgkin's lymphoma, and also there could be some diseases where metastasis can happen to the spleen. What else can happen? Blood clots in spleen or liver. There are some blood clots which are seen in liver and spleen, enlarged spleen can happen. Certain types of anemias like hemolytic anemia, where the blood cells are destroyed, hemolytic anemia. Cystic fibrosis, in these conditions also you will find spleen is enlarged. Infections including mononucleosis, syphilis, malaria, endocarditis. Even in endocarditis, infection of heart linings. So these are certain infections where spleen is seen to be enlarged. Even liver problem. And this is very, very important to understand that even liver problem like cirrhosis. When cirrhosis happens, retrospectively, you will also see that in coming advancement of the days, the spleen also gets affected. Many cases I have seen where liver is cirrhosed on the one side, other side, when you palpate, you see spleen is enlarged. So then you will need a remedy which acts specifically on spleen, or a remedy which acts both on liver cirrhosis and splenomegaly. Or there could be some inherited metabolic disorders like Gaucher's disease, which could be a rare commodity, but yes, It could be. These are the conditions where spleen gets enlarged. Last one is inflammatory diseases, including sarcoidosis. Anything to do with inflammation in the body. When inflammation is too much, then you know what happens. A lot of WBCs are produced. Lymphatic system has to work extra. Sarcoidosis is one of the conditions where enlarged spleen is seen. Protein disorders like amyloidosis. So sarcoidosis, amyloidosis. Functional asplenia means when there is the spleen stops functioning. Which are the conditions? The condition happens when spleen doesn't work as it should be. It may overreact like hypersplenism and destroy healthy red blood cells. Destroying too many blood cells can increase the risk of infection, leading to bruises and bleeding. Functional asplenia can result from that. So what happens exactly is that first hypersplenism happens, means the spleen has to destroy the dead cells. But what it does is that it starts overreacting, and not even the dead cells or the old mature cells of the blood cells, red blood cells, it starts attacking and destroying even the healthier red blood cells. And that's why you will see a lot of fatigue happening, bruising happening, bleeding episodes coming on, because RBC is being destroyed, the normal ones. And ultimately, a compensation of that, asplenia can result in. The conditions can be accidents or trauma. These are important ones which cause this condition, damage to the spleen. Celiac diseases it has been seen that celiac diseases can also cause this condition. Sickle cell anemia is very common. Third is damaged or ruptured spleen. Your spleen can rupture or tear from injuries or trauma, like car accident, blows, abdomen on the belly, the main causes of spleen. This life-threatening injury can cause severe internal bleeding. Symptoms of ruptured spleen include a quick heartbeat, nausea, dizziness, pain under the ribs of the left thigh. Now, this is a very critical condition. So in short, I've just given you a brief about a spleen as an organ. This is a short video just to give you a glimpse of it, because this is how I study. When I have to study organ remedy, first I will read the organ functions, the physiology and the pathology and the clinical application of it, from allopathic side, so that at least I have an idea that in which condition I can see, what are the symptoms, how can I differentiate, what are the common symptoms. And this helps me a lot to differentiate between the organ remedies also. So after listening to this talk, now you can proceed for the other lectures of spleen remedies, where specifically I'm going to talk about the organ remedies that has been used homeopathically in these conditions of spleen disorders. Thank you very much.